Much as science is the seeking of knowledge, philosophy is the seeking of truth. Every individual through the entirety of their life, through their experiences, interactions, and learning, have amassed their own unique perspective on the meaning of life and their role in life. Being human is an evolving process, though many think that they are at completion. Having a formalized philosophy is like having a map, so that the traveler may know where they have traveled and may abide to the best route to reach their destination. As Lewis Carroll said in Alice in Wonderland, "I cannot go back to yesterday because I was a different person then. But we can maintain a course that is indicative of our beliefs by formalizing our philosophy. As an individual chooses a vocation, they will further define their personal philosophy through their educational and professional inculcation. Their personal philosophy highly influences the individual's professional nursing philosophy and practice. It is important as nursing professionals that we acknowledge our belief system, to know it wisely, so that we may practice according to our beliefs. As we encounter shared interactions with our patients, we must remember our perceptual approach and understand that the other individual perceives through their own philosophic framework. The essence of my personal philosophy holds that humans are inherently equal and should be treated with compassion, dignity, humility, trust, and responsibility. As a consequence of our innate right to life, humans deserve to have tantamount opportunity of optimal health and wellness in body, mind, and spirit. Professional nursing care can assist individuals with the advocacy, promotion, and support of their optimal level of wellness through integrative, holistic, empowering, and preventative health care. Some of my guiding factors include the universality and mutuality of human beingness, the ability to have individualistic choice or autonomy measured with responsibility and consequence, the ability and inherent need for humans to learn and adapt, the ability of human creativity and neuroplasticity to impact learning, the ability of social connectedness and interrelatedness to interweave respect and empathy for human perspective and vulnerability. These characteristics capture the essence of my philosophy. Humans are inherently social beings, and while there may be outliers, we find meaning in belonging. I believe that the equality of being human drives the practitioner's empathic ability to listen intently to patient's narrative. The practitioner serves as a guide and a coach with open and transparent communication, assisting the patient to find their own balance and definition of health. The practitioner must keep in mind the power that social connectedness and pretense holds, and empower the patient with knowledge and insight for the beneficial, autonomous, and responsible choice. The ability of humans to continue to learn and change must always be kept in mind. It is the practitioner's duty to help the patient with pertinent knowledge of their health and the repercussions of adherence or non-adherence. Practitioners aid the individuals to determine the goals of change and the requisite motivations to modify behaviors in order to attain those goals. Compassion or caring is foundational for the profession of nursing and may be the most valuable asset. Vulnerability is an important procedure for establishing a compassionate nurse-patient relationship where the nurse is able to immerse themselves in the hurting, illness, fear, and suffering of another, even a stranger. Compassion allows the nurse to see the patient beyond the immediacy of the medical and procedural aspect of the patient's illness. Compassion is so essential that it is seen as professional standard as expressed by Provision 1 in the ANA Code of Ethics. Compassion is more than definitional care. It provides an interactional comprehension of an individual's experience. There is a tacit agreement in providing patient care. The patient trusts the practitioner will help them attain and maintain their right to life, their ability to have physical and mental well-being, and freedom from illness. As part of this trust, the practitioner agrees to maintain appropriate evidentiary treatment knowledge while ensuring wisdom of holistic practice. Compassion requires that the practitioners remain open and vulnerable in order to fully appreciate the patient's narrative. By fully understanding the patient's narrative, the practitioner will be better able to guide the patient along the health pathway. The inherent equality of humans entitles them to compassionate interactions. Maintaining perceptual clarity and empathy will assist practitioners in providing the best care. The practitioner facilitates the patient's well-being and health by providing knowledge through education and guidance. Practitioners must provide appropriately patient-tailored guidance so that they can attain their desired outcome. I seek to empower the patient through education and guiding them to understand their ability to attain their goal. I seek to openly understand my patient's narrative and perspectives, providing rational, empathic nursing care apportioned with sound biomedical knowledge, and empower my patients through promotion and guidance of health maintenance education. My foundational worldview acts as a rudder to steer my philosophic evolution. By no means is this the whole of my philosophy, but it is a start, and it will help guide me in my practice. I plan to further develop this philosophy over the course of my program and my life, so that when I begin to practice, I will have guiding philosophic standards. Thank you.